Hello people, in Pediatrics we are looking at this topic congestive cardiac failure. So what is this cardiac failure? Cardiac failure is something where the heart is not working enough, okay? The heart is unable to pump blood. So that is a failure. The only task a heart has in life is to pump blood, right? If it's not doing that, then it is heart failure. Okay, so this is a normal heart. This is a heart which is not able to pump. So this is a heart failure, or you can say cardiac failure, right? So then why are they using this word congestive cardiac failure? Why are they using this C, one extra C? See, it is nothing but heart failure itself, okay? But it is congestive in the sense the entire body, right? The body will have fluid accumulation, edema. So this is called as congestive heart failure. What will happen if the heart is unable to pump? So here's the heart. It is unable to pump blood. So where will the blood be? In the other parts of the body. It's pooling up. So what will happen because of this blood pooling up everywhere? There will be edema. So how will the person be? Edematous, swollen. Here they have shown you swollen legs. Pitting edema they have shown, right? So basically this is fluid accumulation. So all this is happening because it could be because of many reasons, but one of the reasons can be this heart failure. So that is why heart failure, they have called it as congestive cardiac failure, that's all. See, a lot of types of heart failures can be there. Like you can have right heart failure, right? You can have right heart failure, you can have left heart failure. But overall, what will failure cause? It will cause congestion, right? So, congestive cardiac failure, as simple as that. Heart doesn't pump the blood well. So there will be congestion, fluid accumulation in the body, fluid in the lungs, etc., pulmonary edema. So basically this will be congestive cardiac failure. Heart cannot pump. That is, in the systole, what is supposed to happen? Heart is supposed to pump out a blood, right? And in diastole, it is supposed to fill. So either one of this is not happening. So it is not either getting filled properly or it is not able to pump out properly. So all this can lead to heart failure only, okay? Now, let's proceed. So, understand here that we are looking at a topic in pediatrics, so we will focus only on children, right? And why does this happen, etc. So what are the symptoms? First of all, what are the symptoms of congestive cardiac failure? So basically, we will take it up with respect to pediatrics, right? So you will see that there will be, the child will have very slow weight gain, okay? This is what you have to pay attention here. This is what you notice, right? Slow weight gain. Then you will see that it is taking small feeds and it is easily, fatigability will be there. It is getting tired very easily, okay? Easy fatigability. So understand here that there will be suck, rest, suck cycles. Something like that, right? It will suck, it will breastfeed, it will suck, it will take rest, then again it will suck. Suck, rest, suck cycle, isn't it? Then there is increased work of breathing. So it was putting more effort to breathe, right? So you can say that. Then, see, there can be weight gain, but that weight gain will only be because of edema, okay? If there is weight gain, then that can be only because of edema, okay? This can be uncommon, but this is unusual weight gain, okay? You should understand that. Fatigue we have written here already, okay? Then, what are the other symptoms? They are talking here about perspiration, okay, it is sweating, and then facial puffiness, etc., edema. Understand that there can be orthopnea, that is, if the baby is held against the shoulder, then it will breathe better, okay, so that can be orthopnea. So these are the symptoms according to the pediatric textbook, okay. We are mainly, what can you observe, right, in a baby? So it is having this small feeds. Mainly this is what they will observe, right? It is finding it difficult to even breastfeed, shortness of breath, easy fatigability, swollen legs, which maybe they notice or not notice, slow weight gain, babies having a failure to thrive kind of thing, right? It's not growing adequately. Okay, so these are the symptoms. What will you observe as a doctor? Signs of congestive cardiac failure, right? So you will see that there is tachypnea, this is the fast breathing, tachycardia, heart rate is more, there is persistent cough, Okay. Hoarse cry, wheeze. See again here that was there here. Hoarse cry, wheeze. Right. All of these were symptoms. They are there also in signs. Some of them are there. Right. Cough. Cough can actually be a symptom also. This cough can be more on lying down. Right. That is why they are saying the baby can have orthopnea. So when you make it elevated, right, that time it is much better. Okay. Then there can be hepatomegaly, especially if it's right side heart failure, facial puffiness. Okay. All this can be there if it is right side heart failure. Understand that, can you check JVP and all like adults? No, it is very difficult in a baby to check JVP, right? So anyways, just write JVP here. You just cannot check. It's very difficult. Other things you will see edema of foot, right? As a doctor, you will check edema on the feet, right? And there can be right side and left side, both heart failure can be there. Right and left, both heart failure can be there. That time there can be a cardiac enlargement. There can be a third sound gallop, okay? Peripheral pulses may be poor, with or without cyanosis, okay? With or without cyanosis, okay? So all this can be there. Cardiac enlargement, third sound gallop, and poor peripheral pulses with or without cyanosis. Okay. So, did you understand the signs that you will see in the baby for congestive cardiac failure? Now, let us move on to the causes, guys, etiology of congestive cardiac failure. So, basically, see, there are many ways of telling why the heart failure happens. Let's look at this. In infants and children, you should separate this. Why in infants? Infants are less than 1 year, right? So they can have congenital heart disease, and there are so many congenital heart diseases, guys, like ASD, VSD, patent ductus arteriosus, truncus arteriosus, TAPVC, that is total anomalous pulmonary venous connection, is it? Then TGA, transposition of great arteries or vessels, right? You can say. Then you can have atrial stenosis, coarctation of aorta. Then what else? The pulmonary stenosis, tetralogy of Fallot, pulmonary atresia, tricuspid atresia, Epstein anomaly. So many congenital heart diseases itself are there. Okay, guys. Okay, so there's one more here, HLHS, hypoplastic left heart syndrome. So many are there. Okay. Now, let's move on. Myocarditis, primary myocardial disease. They have some myocardial disease. So you can understand the heart will have so many layers. It has endocardium, myocardium, and around the heart you have the pericardium. So they're talking about this middle one. That is the muscle. Muscle is the what? This one here. It will have a disease. So that is myocardial disease. Myocarditis. Right? All those can cause heart failure. Obviously, if the muscle has to work, isn't it? Tachyarrhythmias, bradyarrhythmia. So basically, arrhythmias you can remember. Somewhat irregular rhythm you can say, right? What is arrhythmia? If somebody asks you to define arrhythmia, how do you define it? So basically, you have to say that it is irregular rhythm. That's it. The answer is there in the question itself, right? So the rate or rhythm is not proper. So it can be either fast or slow. Bradycarditis, this child can have. Then what is this Kawasaki disease? So basically in this Kawasaki disease, right, there will be problem with the vessels, right? That is the arteries. So that's what you have to remember. So this is nothing but having inflammation of the middle-sized artery, inflammation of the walls of middle-sized artery or medium-sized artery. Okay. In that Kawasaki disease, if there is coronary occlusion, right? So coronary is what? Something that supplies blood to the heart, right? So that's the coronary artery. Now let us say if there is a problem with this artery, that's what they said, right? This is the artery. In the wall, if there is a inflammation, then what will happen? The heart will not be able to get enough blood. So then what will happen? Heart itself cannot work properly. So Kawasaki disease, so you know what is Kawasaki disease? There is going to be inflammation of the walls of the middle sized artery. So if this artery is something that was supplying the heart, that means it was a coronary artery. So you can understand that this person can have a heart failure. Okay, then let's go to this one. Pulmonary hypertension, guys. What do you think will happen in pulmonary hypertension? So here you have the heart. Now from the heart, the blood, the deoxygenated blood has to go to the lungs, right? So that the lungs will, give me a gray please, yeah. So this is the lung. Lung will oxygenate this blood, right? And it has to return the oxygenated blood to the heart. This is the pulmonary circulation. Now they are saying there is pulmonary hypertension. So there is pressure in the blood vessels which are leading from the heart to the lungs. Okay. So there is very high blood pressure here. Okay. Pulmonary hypertension is there. So what will happen? Can the heart go against this tension, hypertension, pulmonary hypertension? No. It's very difficult for the heart to pump, right? So pulmonary hypertension can lead to congestive cardiac failure. It can lead to what? It can lead to heart failure. Yes. Right. And there are some miscellaneous causes like infections, etc., which can lead to congestive cardiac failure. Okay. We'll not look at that. Let's go to the children part here. Okay. We have finished the infant part. In children, now why can there be heart failure? Okay. Why can there be heart failure in children? So children can get rheumatic fever, that is because of streptococcal infection, right? Sore throat followed by a rheumatic heart disease. Congenital heart disease complicated by anemia, infection, endocarditis. See, whatever they had written as miscellaneous in the infant, right? Anemia, infection, etc. Here in children, they are saying this whatever congenital heart disease, they were born with a heart disease. Now that is getting complicated because of anemia or infection or endocarditis. Endocarditis is what? The inner wall of the heart, endocarditis, right? There is some inflammation of the endocardium. So if this is the heart, inside the heart, whatever you have, that will become the endocardium. The muscle of the heart will be myocardium. Outside the heart, you'll have the pericardium, right? So what are they telling is affected here? The endocardium, endocarditis. The baby was born with some issue, congenital heart disease, but now that is getting complicated because of anemia, infection or endocarditis. Okay. Systemic hypertension. What will happen if there's systemic hypertension? That means this person's blood pressure is more. If this person's blood pressure is more, what will happen? This is the heart. It is trying to pump into a system which has more pressure, right? So can the heart pump into a system which has more pressure? But I thought that this pressure, yeah, maybe the vascular resistance is more, right? That's what I'm thinking at this point. That's why there is systemic hypertension. Okay. Then myocarditis. Myocarditis we already saw in the infant also. Myocarditis, remember? Here also they are saying myocarditis, primary myocardial disease. These are very similar, isn't it here? Then pulmonary hypertension, primary, secondary. Same thing they have given, guys. Okay. Let's try to tally this. Pulmonary hypertension, myocardial. Then congenital heart disease. Okay, so now what is different? Let us check. Okay, in babies they have okay, in babies they are blaming Kawasaki arrhythmias. Okay, in kids they are blaming rheumatic systemic hypertension. Okay, and complications because of anemia, infection, etc. So we are done with the causes of congestive cardiac failure. However, people, there is yet another cause list. If it is a diastolic dysfunction, why does it happen? They are saying. See, usually it is not able to pump. You can understand that very easily, right? You need to, for it to pump, what do you need? You need the myocardium and all that. It cannot pump the blood out. Okay, that you are always able to understand. But can it happen that there is diastolic dysfunction, that the heart is not able to relax and it is not able to get the blood inside? Because if it can get the blood inside when it relaxes, then only it can pump during the systole. So why is it that there can be a diastolic dysfunction of the heart? That also can happen, okay? The diastolic dysfunction can happen because of mitral or tricuspid valve stenosis. So where is this mitral or tricuspid valve? So if this is the heart, here you have the mitral valve, here you have the tricuspid valve. There is a stenosis of these valves. These valves have become so small, narrow, right? So what will happen? The blood cannot enter the ventricles, right? So at that time, there can be diastolic dysfunction. It is not able to fill up. The ventricles are not able to fill up, looks like, right? Then pericarditis, constrictive pericarditis. Constrictive pericarditis, I'm just guessing this is the pericardium. It is constricting the heart, is it? So the heart is not able to relax and fill up. Okay, so the constrictive pericarditis. Restrictive cardiomyopathy. Restrictive is again same thing. The word itself you can see. Some cardiac muscle has issue. There is a restriction. Restrictive cardiomyopathy. Then see here in restrictive, they are actually blaming the LV. Okay, left ventricle they are blaming. Pericarditis is something around the heart. Okay, that makes some sense now. Then, ventricular volume overload. So, aortic regurgitation. This aortic regurgitation kind of makes sense to me. So, if this is heart, and there is regurgitation of the aorta, where will the blood come back? It will come back to the left ventricle, let us see. So there will be acute ventricular volume overload. So there is more load on this ventricle. So there's no more blood here. So if there's more blood, what will happen? So they're saying this can be a diastolic dysfunction, right? So when the heart is relaxing, all the blood is coming back, is it? Okay, then myocardial ischemia. What will happen if there's myocardial ischemia? Myocardium will refer to the muscle, right? Myocardium. So there's ischemia. The muscle is not getting enough blood, right? So what will happen if the muscle doesn't get enough blood? Come on, guys. I would say it can't contract. But here they're saying it is a diastolic dysfunction. It can't relax also, is it? Wait, people. There is some more information that they have marked here. See, by this hash mark, they have put it here. Often have combined systolic and diastolic dysfunction. So now that makes sense to us. Right? So, in ischemia will not just affect the systole, it can also affect the diastole. So, that makes sense to us. Okay? Then, where are we here? Marked ventricular hypertrophy. Guys, are you able to listen? Okay, good. So, marked ventricular hypertrophy. Ventricular hypertrophy means what? But if ventricular hypertrophy, it's good, right? They didn't say which ventricle, so I'm going to kind of put both the ventricle as hypertrophied. So if there's marked ventricular hypertrophy, what will happen? There can be diastolic dysfunction, is it? It cannot relax. Kind of makes sense. So much of muscle is there, it is trying to squeeze and contract. So there can be diastolic dysfunction, is it? Okay. Then dilated cardiomyopathy. So again, there's a hash mark here which indicates that it can have combined systolic and diastolic dysfunction. What is dilated cardiomyopathy? Dilated cardiomyopathy. See this heart, so big and so dilated. So it has having some dysfunction. See, it cannot even compress also, right? So it's a systolic also, I'm thinking. Systolic dysfunction also. Okay. The star was supposed to go here. See, mitral or tricuspid valve stenosis, elevated atrial pressures with normal ventricular dilated pressures, diastolic pressure. So basically you understood this already. Anyways, we will repeat. So what did they tell here in the first point? They said that the mitral valve and the tricuspid valve actually have stenosis. That means they are very narrow. So what will happen? The blood will not be able to come to the ventricle. So where will the blood be? In the atrium. So there will be elevated atrial pressure with normal ventricular diastolic pressure. So the problem actually is not with the ventricle's diastolic pressure. The problem will be actually elevated atrial pressure. Okay. So all these are the causes for the diastolic dysfunction. You should have understood now. Not just the causes in infants and children, right? You have to write this, and you can also write the causes of actual diastolic dysfunction will be these. Okay. Now let's move on to the treatment of what? Congestive cardiac failure, guys. So let's bring a nice doctor here to treat this. Whatever you're seeing here written is actually for adults, okay? So let's put this here. I think this is for adults or in general. So now let's go back to the pediatric topic. How will you treat congestive cardiac failure in babies or in children? So here what you have to do is reduce the cardiac work. Work of the heart should be reduced. Reduce cardiac work, because heart failure. So you don't overload the heart. You reduce the work of the heart. augmenting myocardial contractility. Augmenting myocardial contractility. Then improving cardiac performance. Augmenting means whatever is there, you will increase that. Right? It is already there some amount. You are trying to improve that. The intensity, the rate of that work you are going to. The contraction is happening. Augment that contraction. Improve the contraction. Then third point is improving cardiac performance. Okay, performance you should improve. You have to improve the performance of the heart. Let's see how to do all that. Then correcting the underlying cause. I would have put this first, but anyways, correcting the or identifying the underlying cause at least should have come first. Anyways, identifying the cause is important because you have to fix the underlying cause. So how will you reduce the cardiac work? How will you reduce the work of the heart? Very easy. Anybody will say, what will you do? Diuretics, you'll remove the volume overload. Yes, correct only. Let us write here. The first thing actually is doing is rest. See, when you take rest, you will need less of oxygen, etc. Right? So you can actually reduce the activity. You can do, how can you do reduce the activity? You can also sedate, right? Then whatever is the problem, right? You can treat the fever, etc. All these are burning things. Fever, anemia, obesity, right? And then you can reduce all this. Reduce the work. Let's take everything here. All that. Okay. And then come here next, you can give vasodilators. What will vasodilators do? One thing is, if this is the heart, right, and here the blood vessels, you have dilated them nicely. The heart will get less back to itself because these blood vessels are dilated. They will be having some pooling of blood, and the heart can also pump more into these, is it? Easily into these, because the systemic hypertension can reduce. Isn't it? So then coming to these neonates, etc. Right? Neonates, etc. You should make sure that you don't handle them too much. You should give them rest. You should keep them propped up at an angle of 30 degrees. So the edema fluid, etc. in the lungs will reduce. So all this you have to write in the exam, guys. So you can understand that the rest is very critical here, right? You have to rest. Now also, what you have to do is, if you can give oxygen, then very good. If you can give oxygen, even to breathe, right, the work of breathing also will reduce. And the heart again will be happy, right? Even the effort, the energy you're burning to breathe will be reduced if you do mechanical ventilation, right? So basically rest they are talking about. Mechanical ventilation. Then what did they see here? Handle minimally. Then all this is to reduce the work of breathing, etc. Then propped up position. That is 30 degree. Okay, this will reduce the fluid in lungs, right? So all this will reduce your cardiac work. Now we are done with this point. However, some specific details they have given here that also we'll need to look at. To sedate, you can use opiates like morphine, benzos like midazolam. Okay. To sedate, you can use this. To treat fever, you can use antibiotics. Then for vasodilation, you can use nitrates. Okay. So for vasodilation, they have given this thing. See, there will be decreased peripheral resistance. The load on the heart will, there can be increased cardiac output because the peripheral resistance is less. The heart can pump more, right? Then venous return will reduce. If venous return to the heart reduces, there will be less pulmonary congestion. Dyspnea also will become less. So it's kind of good for the lungs and your heart, right? Not just your heart, even for the lungs it's good. Okay. Then the thing is not just nitrates. You can also try ACE inhibitors like captopril, enalapril. These are also effective. Okay, they will reduce the vasoconstriction. That means they will promote vasodilation, something like that. You can say, right? The vasodilators, you can say, or they restrict. They stop the vasoconstriction. But the problem with this is these are it can lead to cough, etc. This can have a side effect of cough. Side effect is cough. Okay. So if this side effect is there, then you can try angiotensin receptor blockers like losartan. These are nothing but ARBs, right? Angiotensin receptor blockers. Example, losartan you can try. And there are a lot more things that the textbook says, guys. We will just tell you that you can use even beta blocker in dilated cardiomyopathy, okay? Not in everything, but they're saying in dilated cardiomyopathy, you can try beta blocker. They are saying like carvedilol, beta blocker, like carvedilol. Let's write that here. Carvedilol for dilated cardiomyopathy. Use carvedilol. Okay, this is beta blocker, right? Beta blocker. Okay. Then we'll put here only for dilated cardiomyopathy. They're talking about beta blocker, carvedilol. Other than that, you can use sodium nitroprusside and phosphodiesterase inhibitors. Like some names are there here, guys. Sodium nitroprusside, if you want, you can remember. Very popular. They're saying these are very popular. Phosphodiesterase inhibitors also, they're saying popular. Okay. So standard, all this you will write for. Reduce cardiac work. How will you reduce the work of the heart? You will make the person rest, sedate the person, handle that person less, put them in propped up position. You can give to sedate morphine or midazolam. You'll treat the fever, anemia, etc. because these will make the heart beat more, right? Or work more. Obesity also, right? You'll have to treat all this. Then mechanical ventilation, if you do also, the work of breathing also will reduce, right? Reduces work of breathing. Okay. So all this will reduce the work of the heart. Next we will go to augmenting myocardial contractility. So people, now we are looking at augmenting myocardial contractility. That is, the heart is contracting, but it's not contracting enough. So you're augmenting it, you're increasing it. Okay, so you're making the heart contract with more force. So for that you can use digoxin, right? This is called as digitalizing. See, it's a new age era. You will think digitalization means something else. Here in medical, it is digitalizing. Okay. So you can give digoxin, right? So they are giving digoxin. How much? They are talking about the dose, etc. here. Initial dose and then maintenance dose. Actually, this you can give oral. Orally you can give as a tablet or an elixir you can have. Then you have parenteral also you can give. So basically this is an ionotropic agent. What is it? This is an ionotropic agent. So look at this. Ionotropic agent, like example digoxin you will give, right? You will improve the cardiac output by augmenting the myocardial contractility. How is it available? You have oral form, you have tablet and elixir form. Okay, elixir. I think that's something that you can drink or something, isn't it? Parenteral also you have, right? No need to go oral route only. Parenteral, correct, right? Okay. So, what else? You should beware of the toxicity. Digitalis toxicity, you should be aware of it. So, you cannot give so much. Right? You should, especially you should check the PR interval. Then you can do electrocardiogram, that is ECG, isn't it? Check ECG PR interval. Okay. So, what else? You should not give digitalis. Do not, or you have to use with care. You have to use with care in following situations. So how shall we? Caution you should use in premature infants. Okay. Heart failure due to myocarditis. If there is myocarditis, right? And if there is very cyanotic patient, you should not give digitalis. So the heart will become very sensitive to digitalis. Okay. So the heart can be very sensitive to digoxin. Looks like that is the reason that they are telling that if it's a premature infant or if it is very cyanotic or myocarditis, if they have, you should be careful about giving an inotropic agent like digoxin, right? They are telling other things: myocardial damage, gross cardiomegaly, hypoxia, acidosis, hepatic, renal, pulmonary insufficiency. All these things will increase the sensitivity of the myocardium to digitalis. Okay, so you have to be careful. It's not just in these people. If there's very sensitive heart, right, all these conditions, you should be very careful. Now let us go to the other inotropic agents, guys. After this digoxin, we will go to the other inotropic agents. These are actually intravenous. Okay, like there are three groups here: catecholamine, dopamine. Right, these are catecholamine inotropes, that is dopamine, dobutamine, and adrenaline. Then you have phosphodiesterase inhibitors like amrinone, milrinone. Okay, then you have calcium sensitizer like levosimendan. So easy, right? All these names. Yeah. So there are three groups. Okay, you can remember the names if you want. So did you get it, guys? So there are a lot of inotrope examples. So not just, where are we? Here. Not just digoxin, you have a lot of inotrope agents, dopamine, dobutamine, adrenaline, etc. So what will they do? They will augment the myocardial contraction. Okay, so the heart will become more powerful. It will contract with more effort, right? It can contract stronger. So this is augmenting myocardial contractility. Now where are we? We finished the second step. So the first step was what in treatment of congestive cardiac failure? It was reduced cardiac work. Now we have finished augmenting myocardial contractility. The next two are here, that is improving the cardiac performance. Now we will look at this, and then correcting the underlying cause. So here they are talking about diuretics, guys. What do diuretics do? They will make you pee more, correct? They will try to remove the volume overload. They will try to make you pee. Your kidney will produce so much of urine. So this is diuretic. What will happen if the water, you are losing water from your body? Obviously, you will, I hope you are not drinking all the water back, but otherwise the amount of volume overload, right, will become less. So that time your heart will also have less volume, right, to pump. So you got it? So you will, it will have less return. The venous return to the heart will reduce. So there will be preload will reduce. The blood that is coming to the heart will reduce. So preload will reduce venous return to the heart. So basically what, hope you know the basics anyway. See, the heart receives deoxygenated blood, right? So that is reducing. Okay, so what are the diuretics that you give in pediatrics? We are discussing pediatrics, isn't it? So they'll give furosemide with a potassium sparing diuretic, because this furosemide will allow loss of potassium. So you should give furosemide with a potassium sparing diuretic. Example, triamterene, spironolactone, amiloride. Okay, so you can give this in a combination. You should give in combination. They are saying you should give furosemide with a potassium sparing diuretic. This is the diuretic. Okay, so it will not only prevent potassium loss, it can also prevent magnesium loss, is it? So it will reduce the risk of arrhythmias. What else? Last one, let us go to. Last thing that we have to do is correct the underlying cause. So let's make this underlying cause red. So you want to correct it. Okay, so what is it they are telling here? Correct the underlying cause of congestive cardiac failure. Okay, so that's what we will do now. What are the causes? You know the causes, isn't it? So you will have to fix those. Let's go back to the causes and read the causes. Yeah, the congenital heart disease, all these babies born with a heart which is having so many defects, kind of a thing. Could be an ASD, VSD, patent ductus arteriosus, transposition of great arteries, vessels, TOF, tetralogy of Fowler, then what else? TAVPC, is it? Total anomalous venous pulmonary connection. No, TAPVC. Total anomalous pulmonary venous connection or something. Then truncus arteriosus. Then that if there is a coarctation of aorta, or if there is a hypoplastic left heart syndrome, so many conditions can be there, right? All that you'll have to fix. So you'll have to go back to the causes and write how to fix them. If you have time, you can write, okay? And what else? If the baby has myocardial disease, if it has Kawasaki disease, if it has pulmonary hypertension, reduce the pulmonary hypertension. If it has anemia, fix the anemia. If it has infection, give antibiotics, etc. Right? If it is a bacterial, I'm saying. Otherwise, fix whatever issue is there. Endocarditis, fix it, right? Any valve disease, right? All the valve disease, fix the valves. Rheumatic fever, give prophylaxis, prevent the heart disease, right? Then systemic hypertension also, you can reduce the hypertension by diuretics or vasodilation, right? Then all this you will do. So once you remove the cause, definitely the CCF can get corrected. What do you say? Fix the cause. Look at the causes. Okay, that's it. In adult, we have seen this less salt, less fluid intake. Same thing. Okay. Now, in this, we have completed CACF. Please understand that in this video, we have not finished congenital heart disease. Okay. See, in this video, we have not looked at congenital heart disease. Congenital heart disease, names so many are there. Why does it happen? Is there some exposure to some teratogens in the prenatal period? All that we will be looking at in the next video on congenital heart disease. We have in this video looked at only at congestive cardiac failure. Okay. So what have we looked at in this video? We have looked at congestive cardiac failure. The heart is not able to pump blood well. So because of this, there will be congestion all over the body, right? Fluid accumulation. So that is what is congestive cardiac failure, or you can simply say heart failure. The symptoms will be something like poor weight gain, difficulty in feeding, breathless, because it's having pulmonary edema, right? So it will be breathless, it will be breathing fast, that is tachypnea, right? And it can have orthopnea, then it can have persistent cough, wheezing, irritability, perspiration, that is sweating, restlessness, pedal edema, hoarse cry, wheeze. All these can be there for the baby. Small feeds, the suck-rest cycle, is it? Then coming to the signs as a doctor, you will see that there can be, look at this table here. If it is, yes, once again, look at this, the right side should be on the side and left side should be on the side. Right side, if there is failure, you can have hepatomegaly, facial edema, right, jugular venous engorgement, pedal edema. This makes sense, right? Because the man is like this. Wait. The man is like this. So if right side heart has failed, so he can have facial edema, hepatomegaly, jugular venous engorgement, pedal edema, right? And if left side has failed, what will happen? Left side of the heart has failed, then he can have tachypnea, right? Some problem with the lungs. The lungs are not able to send back the blood, isn't it? So there's edema here. So he'll have tachypnea, tachycardia, cough, wheeze, rales in the chest, all that he will have. Mostly those are respiratory kind of, you are understanding, not respiratory symptoms. What I'm saying is the lungs and its effect because of cardiac cause. Then coming to failure on either side if there failure, there can be cardiac enlargement, gallop rhythm, that is S3 you can hear, peripheral cyanosis, small volume pulse, right? Obviously the cardiac output is low, means what? The pulse will be small volume. There's lack of weight gain, okay? Then something extra here, look at this, based on the time of onset of the congestive failure, you can guess what the possible cause, underlying causes. If it's birth to 1 week that is the baby is presenting, it can be because of a duct-dependent systemic circulation. That is a ductus arteriosus, it is still using for circulation, okay? 1 to 4 weeks if the baby is coming, then you know that it could be a patent ductus arteriosus in preterms, okay? 1 to 2 months, it can be a transposition, okay, with a VSD or PDA. 2 to 6 months, it can be a ventricular septum defect. Remember this one, okay? 2 to 6 months baby is coming you with congestive failure, could be a ventricular septal defect, because we have seen that this is a very common anomaly of the heart also, right? So VSD you can remember. Then causes of congestive cardiac failure, we told you that the causes are congenital heart disease, myocarditis, myocardial disease, arrhythmias, Kawasaki disease, pulmonary hypertension. These are the 4 things you have to remember for infant, okay? And in children, rheumatic fever, Then congenital heart disease, which is now getting complicated because of anemia, infection, endocarditis, right? Then systemic hypertension. Then again myocardial disease and pulmonary hypertension. These are very common, okay? Same things you are writing in both the places. Causes you have looked at. Then you have seen if diastolic function is not working of the heart, it could be because of there is some ventral, valve stenosis, constrictive pericarditis, restrictive cardiomyopathy, right? There could be a volume overload, myocardial ischemia is happening, or a ventricular hypertrophy, then dilated cardiomyopathy, etc. So these are the causes of congestive cardiac failure, especially the diastolic dysfunction. See, the failure can happen because of systolic function or diastolic function. If it is diastolic, what the causes are, they are telling you, right? So either the heart is not able to pump blood out, or blood is not able to enter the heart. So what will they pump anyways? So all this will cause heart failure. So how will you treat congestive cardiac failure? Reduce the load work of the heart. You make the person rest. You put them up, you sedate them, opiates you can give like morphine, midazolam, etc. Then you reduce the handling of the child, don't handle it, let it rest, right? You put it up in a proper position at 30 degrees so that it will reduce the fluid in the lungs, right? So you treat the underlying cause which is making them use the heart excess, like fever, you give antibiotics, obesity is there, you have to treat that. Anemia also can make the heart work more. All that you'll have to treat. And if the person is using so much effort to breathe, then you can do mechanical ventilation, so it will reduce the effort of breathing also, right? Then you can give vasodilators. Vasodilators you can give like nitrates, ACE inhibitors, right? Like captopril, enalapril. You can, because of ACE inhibitors, if the baby develops cough, right? If you suspect that is a problem, then you can give angiotensin receptor blockers like losartan. This they are not very particular about, only if this ACEs fail kind of a thing they are telling. Nitroprusside, sodium nitroprusside, very famous now they are saying, and phosphodiesterase inhibitors like milrinone. All these are very important, looks like at this point of time. Only for dilated cardiomyopathy, they are saying you can try carvedilol, okay? So all this is about reducing the cardiac work, okay? This will also reduce pulmonary edema because the vasodilator will reduce the venous return to the heart also. Then coming to augmenting myocardial contractility, for this you saw that you can give inotropic agent like digoxin, which can be given as orally as a tablet or elixir, or you can give parenterally, but you have to be very careful about digitalis toxicity, and you should not give it in people who are premature, right? Premature infants, myocarditis if they are very cyanotic, you should not give. The heart will be very sensitive, okay? And if there is myocardial damage, gross cardiomegaly, hypoxia, acidosis, hepatic or renal or pulmonary insufficiencies, then those people also digoxin they are saying you should not give, okay? So then very sensitive heart, actually they have given for these conditions. Okay, now let us move on to the other IV inotropic agents. You can give catecholamine in inotropes like dopamine, dobutamine and adrenaline, alright, or you can give phosphodiesterase inhibitors like same thing, milrinone. Everywhere milrinone they are saying, we'll also learn milrinone, okay. Then levosimendan. Levosimendan is a calcium sensitizer. They are also talking about that. So it will make the heart contract with more force, is it? Augmenting the myocardial contractility. Then you saw how to improve the cardiac performance. That means you want to reduce, actually here they are talking about reducing the venous load. That is the preload. Venous return to the heart you want to reduce, preload you want to reduce. For that you can give diuretics like furosemide, and you should combine it with potassium sparing diuretics like triamterene, spironolactone, amiloride, okay. Then you have to correct the cause of the CCF, that causes list you have seen, right? Excessive salt also can be avoided, guys. That's what they are saying. That's quite similar to the adult. So that is all about congestive cardiac failure. Bye bye.